Okay, so I'm going to demonstrate the Watson's or the Scaphoid shift test. This is a test that looks at tests the ligamentous stability of the scapholunate ligament, and you're looking at the ability of the scaphoid to stay in place relative to the lunate. So it can give you more information about whether there might be some instability or a scapholunate dislocation. Commonly this happens after a fall or a foosh, a fall on an outstretched hand or arm, and can also be concurrent with a distal radius fracture as well. In the year 2013, Valdez et al. Looked at the psychometrics of the test, and it has a positive likelihood ratio of 2.76 and a negative likelihood ratio of 0.25, giving it about moderate clinical value in isolation. So for the test, we're going to find the scaphoid just off the radius on the palmar side. We're going to open the patient's hand. I'm going to apply pressure onto the palmar aspect of the scaphoid, slight pressure. I'm going to start her in ulnar deviation and slight extension. So her scaphoid is relatively in line with the radius to begin. And then from here, I'm going to take her into radial deviation and flexion while maintaining my pressure on the scaphoid. And if there's any disruption of the scapholunate ligament, then you'll see movement backwards, right? Because the scaphoid wants to move into flexion as you radially deviate and flex the wrist. It will want to come along with that. And then what you'll see is as you release your thumb, if it clunks or moves back into place or the patient notices pain or a shift, that's a positive test that there is some instability at the SL ligament. And that's a positive Watson's or scaphoid shift test.